Hi, everyone. Happy to be here. I'm Christine Gibson. On socials, I'm TikTok Trauma Doc and Gib Trotter MD, Christine Gibson MD. I wrote a book called the Modern Trauma Toolkit, which is a primer on toxic stress that's really solution-focused, very accessible. And I also co-founded a company that helps people with psychological safety in the workplace. That's Safer Spaces Training. And my why is really similar to what we've heard from both Michelle and Samana. Just having experienced some negative work environments that affected me personally and professionally, because I mean, it's also interconnected. And so I work primarily now as a trauma therapist, and I feel that we've got traumatic workplace environments happening, and it sets up trauma responses in our bodies. So I just am hoping to get the word out about what's happening and what we can do about it. So of all of the many important topics that matter regarding mental health at work, because I'm a physician and trauma therapist, kind of the clinical manifestations of how it shows up like in the individual is what I know the most about and what I love to share, because I think people don't really understand the difference between asking, well, what's wrong with this person? You know, why are they so angry today? Do they always seem irritable? Why is this person insisting on buying me coffee twice a day? Like, a lot of these things that are behaviors that show up in the workplace are actually psychologically caused issues, and we just don't have a common language for that. So when we talk about a culture of psychological safety, so much of it is just an awareness of that inner journey that a lot of people are on. And I mean, a lot of it has to do with developmental or childhood events that happen, but it can also be inherited. So lots of folks that are First Nations, racialized communities, communities that have faced war or are facing war, these things live in our bones. And I don't think enough people really understand that even if we don't have a language about something that bothers us, it can still show up in our behaviors. And so in the workplace, fight and flight can look like somebody who's willing to take on lots of projects and is just really a go-getter, and they're very assertive. But when somebody's outside of that window of tolerance, it can turn into anger and irritability, or quitting their job every 6 months, because that restlessness can turn into running away. And freezing collapse can just look like somebody who's really mellow and they never really bother anyone, and they're sometimes helpful because they're worried that they're going to be hurt if they aren't. But eventually that can turn into somebody who can't get out of bed and can't get their projects done. So the more that we're aware of what's happening in the mind body with our colleagues, and we have a common language and a common understanding that a lot of times it's not their fault, there's something that's happened that has created this situation. We're not all going to be therapists, but we can all learn lots of ways to support. A lot of that is providing a pathway towards authenticity. So the evidence shows that the ability to be vulnerable and honest on a team really matters when it comes to feeling safe. Connection can be within relationships at work, and we don't always need to be besties, but could you help people connect to music, connect to nature, connect to a pet? There's lots of ways that you can foster connection at work that's even beyond the human connection. And then what does it look like to foster an environment of trust where we really believe and we know in our hearts that people have our backs? So those are just a few quick tips. There's a lot more, obviously, in the Modern Trauma Toolkit, my book, and I'm excited to hear what everyone else has to say.